Hello, I'm Dr. Vanita Rattan. I'm a doctor but also a cosmetic formulator specifically for skin of color. Today's video is a very special one. I actually ran one of the first ever summits for acne specifically for skin of color earlier this year. And I filmed it in order to share with my global skin of color family. I think it was a very unique event because we were discussing why acne is different in skin of color, the different actives that you need, the best and worst products on the market suitable for skin of color, the myths and misconceptions when it comes to acne and skin of color, at what age we should start treating it, and is that different for Caucasian skin? So I think if you suffer with acne or your children suffer with acne or you're treating people with acne with skin of color, I think you're going to find today's session very, very useful. It is a long video. It's one of the longest YouTube videos I've ever uploaded, but I also hope it's probably one of the most beneficial videos that I've uploaded too. I cannot wait to hear your comments down below. If you've got any questions, please do write them. Don't forget, I'm in the comment section for 1 hour at the launch of every single video. And this one is no different. I can't wait to meet you in the comment section. Don't forget to subscribe and hit that notification bell so that you know every time I'm here, you can come and ask me your questions. Without further ado, let's start the Acne Summit. I think it's safe to say that if you are here learning about acne on a Friday night, you are really into your skincare, and I appreciate you for that. Right, so the first question here really is acne in skin of color. Dr. V, really? Is acne different for Caucasian skin compared to skin of color? And the answer is yes, because for us, not only do we get acne, we get the red marks and we get the brown marks too. And so actually, when we're treating acne and skin of color, we can't just treat the acne because often the hyperpigmentation is more distressing than the original acne itself. It can last for decades. Hands up, how many of you have actually experienced acne? So have a look around. That's pretty much all of us. And I'm going to tell you just how prevalent it is. So 85% of young people between 12 and 26 experience acne, and 35% of adults. So a lot of us may never have experienced acne as a teen, and suddenly you're experiencing it as an adult, which can be, tricky. So when does it happen? It happens in the 3 Ps of your life. It happens during puberty, happens during your periods, and happens during pregnancy. Hands up, how many of you get that monthly breakout the week before your period? Okay, so I do have some good news for you, and that is what you need to do is switch up your skincare routine 1 week before your period, and you just pop in your salicylic acid exfoliator for that 1 week, and your skin will thank you. At the end of today, everyone's going to get a kit from me, and it will have your salicylic acid in there. It's your leave-on exfoliator, and so hopefully your skin will be much happier. Okay, right, this looks like a complicated slide, but I'm going to break it down. What exactly is happening when you have acne? So the pathology of acne is basically, imagine you get an increase of testosterone that happens during puberty. And then you've got your pore. Your pore starts to fill up with sebum. You can imagine your pore like a cup, filling up with fat. And at the top, you have something called hyperkeratinization taking place. So that's just a fancy word for sticky skin cells. So now you've got a pore with sticky skin cells at the top. And it's clogging that pore. You've now got no oxygen in that pore. And guess which bacteria loves an anaerobic environment? Anyone? C. acnes, yes, well done doctors at the front. C. acnes bacteria has a party. It starts replicating, it's feeding on that oil, and it's converting those triglycerides into glycerol plus free fatty acids. Now, free fatty acids are the enemy. They are so irritating. That's what leads to the inflammation. And inflammation in skin of color leads to? I don't even need to be here. Correct. So now we have acne, we've got the red marks, and we've got the brown marks. So what are we supposed to do about it? The good news is that you can combat acne along this acne pathway. And I'm going to go through it now. I call these the 8 magic categories for acne. The top 4, most of you have probably heard of and used, but the next 4 are what we need in skin of color. So starting off with niacinamide. Hands up, how many of you have used niacinamide? We all know niacinamide. I think The Ordinary made that ingredient very popular. The mistake they made, however, is that we should be using that in the 2 to 5% concentration. At 10%, it can be a little bit too irritating, so that 2 to 5% is a sweet spot. That controls sebum. That's the number one thing that we want to do. The second thing we want to do is add in salicylic acid, because what does salicylic acid do? It goes into that pore and it unclogs it, literally scoops it out for you. So it's a wonderful fat-soluble acid. We want that at 2% as a leave-on exfoliant. The next thing we want is your vitamin A. So vitamin A, we've got either retinol or retinaldehyde over the counter. Retinaldehyde is my favorite. It's non-irritating. Or you can get prescription only, which is your isotretinoin and tretinoin. So hands up, how many of you have used vitamin A for acne? Yeah, and keep your hands up if you've used prescription vitamin A. Yeah, so that's actually quite a lot of you. But it's very effective at helping hyperkeratinization, those sticky skin cells at the top. The next one is benzoyl peroxide. So remember I told you C. acnes loves an anaerobic environment? How do we kill a bacteria that loves an anaerobic environment? What do we need to poison it with? Only one person. I'm sure more of you are following my YouTube channel than that. Come on. Oxygen. So benzoyl peroxide will poison the C. acnes bacteria with oxygen. We want that in the 5 to 10% range. Now, most of you have probably used these ingredients, but the next set of ingredients are what we need to be using for acne with skin of color. Starting off with your tyrosinase inhibitors, things like alpha-arbutin, vitamin C, green tea extract. That's what calms down the melanocyte and helps to bring it back to normal. The next is azelaic acid that we need for red marks. The next are anti-inflammatories, so things like panthenol, allantoin. We look for those ingredients in your acne routine. And then lastly is humectants. So the problem with acne routines is that they are drying. Whether it's salicylic acid, whether it's benzoyl peroxide, they can be very drying to the skin. And then what happens? Your skin becomes sensitive. It starts to flake. And this happens with anyone that's been on any sort of acne routine for a long period of time. And now you're in a whole other ballgame because now you've got more skincare issues. So look for humectants such as glycerin, high up on the INCI list, on your ingredients list, to make sure your skin is well hydrated. Okay, so the next question you're saying is, okay, Dr. V, that's great, but you just chucked a whole bunch of information, and actually all I really want to know is what should I buy? So I've done the market analysis for you. As you know, none of my content is ever sponsored and will never be sponsored. These are the products that I love, that I'm happy for you guys to purchase, are non-irritating, they're fragrance-free, and they have percentages. They have the correct actives at the correct percentages. So when it comes to your washes, you can choose. Do you want to go down the benzoyl peroxide wash route, or do you want to go down the salicylic acid wash route? And I've chosen the best ones on the market that are also affordable. Then you want your exfoliator, 2% salicylic acid, and these are the ones that I think are best on the market. Has everyone got a booklet, by the way? Everyone's got a booklet, so I've already given you this information, hopefully, so make your life a bit easier. And this is the number one question I get asked is, Dr. V, what is the best moisturizer for oily, acne-prone skin? And I went through everything from the UK and US, and these are the best products on the market. There was one problem, however. None of these products had those 8 categories of ingredients that we need for skin of color. They didn't have tyrosinase inhibitors. They didn't have azelaic acid. And so I thought I'd make your life a little bit easier, and I put all the ingredients that we need for acne and skin of color into one kit. And this is Trio Blemish. So I'm just going to quickly run through this with you. Trio Blemish Face Wash has got your niacinamide, your salicylic acid, and acne calm, so your antibacterial. Trio Blemish Exfoliator, I put in 2% salicylic acid and 5% glycerin, really important humectant, so that when you use it tonight, when you all get your kits, you're going to feel just how hydrating the acid is. Then the AM gel and the PM gel. So your AM gel, it has got niacinamide, your vitamin C, your glycerin as well that you use in the morning, and then at nighttime is your PM gel, which is great for the hyperpigmentation. And that's where it gets quite tricky. A lot of the hyperpigmentation creams are comedogenic. So to create a gel-based, non-comedogenic tyrosinase inhibiting cream was very difficult, but I think this particular product out of the whole range is my favorite for that reason.
Right, just to give a quick overview, these are the clinical study results, and this is a routine, but I don't want to labor too much on trio blemish. I'd like to pass the stage over to Dr. Shweta. Thank you.
Good evening, everyone. Thank you very much for having me. Dr. Vanita, thank you so much for the invitation. I'm so excited to be here. So my talk is nice and simple. It's about the common do's and don'ts with acne. A lot of you will be familiar with many of these, so bear with. Just going to run through them. Basically, acne is one of the most commonly seen skin conditions in general practice, so we see a lot of it. My number one do is to cleanse and to be gentle. So a common phenomenon with acne and oily skin is that people over cleanse, and that can often cause dryness, rebound sebum production, and then a gradual flare up and worsening of breakouts. So my advice with cleansing is no more than twice a day. And be gentle. So if one of your cleansers can incorporate a nice, gentle exfoliant like salicylic acid, which, like Dr. V says, unclogs your pores, that's going to really help with the cleansing regime. Number two is to moisturize. Again, a common myth associated with acne is that oily skin doesn't need that moisturizer. Here, we need moisturizer for two reasons. One is to maintain the skin barrier function of the skin. And secondly, a lot of the actives can often dry the skin. So we need to add that moisture in to protect that barrier. Number three, as with most things in life, be consistent. So don't expect overnight results or miracles, whether it is an ingredient in your skin regime, your over-the-counter treatment, your prescription treatment, or your antibiotic. You need to allow time for it to work. And with the skin cycle, that's usually 6 to 8 weeks. So be patient. Where possible, number four, is to treat the trigger. So acne, as we know, is multifactorial. It can be due to genetics, it can be due to hormones, stress, and there's even an association with food. So where possible, you want to address the trigger. If it's hormonal, deal with the polycystic or ovary syndrome, or if it's to do with food, you want to be identifying your trigger food. There's an association with dairy, so look for that trigger. Number five is to seek professional help. So here, use that guidance, whether you need guidance for skincare ingredients, what to use when and how, whether it is what to use over the counter, or medical advice for antibiotics, prescription treatment, that sort of thing. I'd like to add on here and touch on mental health. Acne can have a huge impact on your confidence and self-esteem. So seek professional help here as well if it is affecting you. Moving on to my don'ts. So like I said, bear with. A lot of my don'ts you're familiar with, but repetition is a great form of emphasis. So, first one is don't sleep with your makeup on. So we've all been guilty of this at some stage. Be careful, because that's when your skin cells are repairing and rejuvenating. And if you're clogging them up with makeup and not washing, your skin isn't able to repair and rejuvenate. So, give your face a little wash before you tuck yourself into bed, and make sure you're consistent with that. Number two, avoid squeezing. So again, we're all guilty of this. When we see that little whitehead popping up and you just want to give that a squeeze, don't do it. Quite often, the after effects of that, so whether it is inflammation or whether it's scarring or pigmentation, is so much harder to treat than that one little spot. So don't squeeze. Number three is to keep it simple. This is something I follow personally as well. Don't be using too many products in one go. Do a bit of trial and error. Give your time to adjust that ingredient or that treatment. And allow the sort of skin cycle so that you know what works for you. So devise your own cocktail of skin ingredients to treat your acne. Number four, there are certain things that shouldn't go on your face. So I would say here, kitchen ingredients should stay in the kitchen cupboard. And, you know, we have grown up with a lot of myths and wonders. So baking soda and all of that, just leave it in the kitchen. I'm going to touch on abrasive scrubs here. So one of my beauty confessions was the use of harsh physical exfoliators. Again, these can cause micro tears in the skin and often, you know, cause rebound inflammation and flare-ups. So be careful. Finally, sun exposure. So too much sun, as we know, isn't good for your skin or your acne. So if you're going out, make sure you're using your sunscreen, which is broad spectrum, has UVA, UVB cover. And obviously, because it's for acne-prone skin, you want to be using something that's non-comedogenic and skin-friendly. So something light, something you're going to use every day. Thank you so much. I could go on and on, so thank you for listening. And I'm going to pass the baton on to the lovely Dr. Basha.
Hello, good evening, everyone. Lovely to see everyone here. Thank you so much, Dr. V. I have been watching your YouTube for a long time now, so I have learned a lot from there. So my topic is food and acne. Before I start, I'm just going to tell you guys a little bit about myself. So I'm a GP trainee. A lot of the doctors here, they're established doctors. I'm just very early in the stage of my training. I'm former Miss England. I've been in the beauty industry for many years now, 10 years now. And one of my key passions is actually type 2 diabetes, lifestyle medicine. And that's why I'm also an ambassador for Diabetes UK. Anyway, so acne and food. Now, we've talked already about inflammation in the skin, and we've also talked about PCOD and hormonal effects. Now, the two things that, these two things are sort of combined in a process called insulin resistance. And as I said, I am passionate about diabetes, so insulin resistance is what we see in type 2 diabetes. Right, so I'm just going to explain to you guys this horrible drawing that I made on paint. For those of you that did a bit of biology at school, I'm sure most of you did, that is a cell in the middle, with the black dot in the middle, and that is a blood vessel next to it, with lots of lovely red blood cells. The blue stuff is your glucose molecules, and the key, yes, that's a key, it's a very ugly key, is your insulin. Now, this is just a schematic to understand how insulin works. Essentially, insulin is like a key. It opens the lock to your cells to allow sugar or glucose to enter your cells. So what tends to happen? Every time your blood is exposed to any kind of glucose, your pancreas sends in all this insulin to push all that sugar or glucose back into your cells. Now, if you keep exposing your blood to things that have high sugar spikes, essentially, you will over time keep pumping out that insulin, keep using that key. And what happens to a key after you use it over and over and over again? It gets worn out, right? And that's exactly what happens in insulin resistance. The insulin that you were using before stops working over time, so your body needs to use more and more insulin. And over time, your cells just stop responding to that insulin completely, and you're left with a really high blood sugar level, okay? Of course, that tends to happen worse when you're doing a lot of a yo-yo effect with your diet, and that tends to happen when you're having lots of high glycemic index foods, that are foods that release more sugar, okay, or raise your blood sugar. This effect is lessened when you've got more of a flattened effect, and we'll talk about what foods essentially have released less insulin. All we care about is releasing that insulin less, okay? Now, insulin resistance, again, I know my topic is food, but we will come back to that. It's important you understand how it works. Dr. V talked about this initially. PCOD is something that is really heavily linked with insulin resistance. In fact, it's one of the precursors of type 2 diabetes in females, polycystic ovarian syndrome. it causes hormonal changes, and more importantly, it releases more testosterone. And Dr. V said earlier, what happens with testosterone? You get more sebum production and hyperkeratinization. So that cup fills up with more sebum, and you get the sticky substance on top. This also happens due to a release of a substance called insulin growth factor. The key is in the name. It's basically a substance that makes everything grow more, including the keratin, including the surface of the top layer of your skin, the epidermis, and also the sebum, okay? Along with that, we also produce more AGEs. Dr. V knows all about it, she's nodding. AGEs, or advanced glycation end products, essentially every time your body is exposed to sugar, I'm just saying sugar, but glucose, the proteins and fats, they get attached to it and they basically freak out, and it causes oxidative stress and ultimately causes DNA damage. It increases the inflammatory pathway in your body as well. So you've got inflammation going on in the background all over your body in response to glucose, which is an essential molecule in our body, but that's what it causes. So that's how insulin resistance is pathologically linked with acne. So the hormonal effect and inflammatory effect, that's been mentioned earlier. So what's the relationship with food? Now, this is quite a wordy slide, I understand that, but I'm just going to summarize it. Essentially, a lot of studies support the notion that actually acne might be a modern Western diet problem, and it could be related to our really amazing civilized life where we have this super processed food, you know, cereals and bread and, rice, white rice. Basically, we've seen a relationship between the populations that have been living on these super processed foods. They tend to have more acne than people living in the rural areas where they're eating more fruit and veg and any foods that release less of that sugar, okay? Now, what food? We talked about high GI and low GI. I've got a little diagram. I'm sure most of you are smart enough to know what kind of foods you should be avoiding. You probably can Google this yourself. But if there's one thing I want you guys to take away, is that with diet, it's really difficult to sustain it if you keep taking things away. So if you take nothing away, I want you to say they're going to add something to your diet, and I want you all to add vegetables to your diet, because vegetables are low glycemic index. Not many people know that, but vegetables are actually all carbs. They're just complex carbs. So you could take away your bread and everything else that's in the second pile, and you'll be fine living on just vegetables. I mean, how do animals do it, right? So add vegetables. They're low glycemic index, so they have more of a flattened effect in terms of your blood sugar. They're nutrient dense. They're full of vitamins and minerals, which actually strengthen your immune system and help you fight that inflammation in your body. They are high fiber, so they're actually really good for your gut health. I know one of the speakers are going to talk about your gut health later. And they're hydrating. They actually contain so much fluid in them. And we all know water is really good for your skin. I don't need to educate anyone on that. Right, finally, some takeaway tips. Again, the first one's really self-explanatory. Of course, we know we need to cut down on our junk food. We know that. But you can also make your carbs that you are eating complex. There's a lot of people here of color, a lot of South Asians. Believe it or not, we have a lot of rice and roti, but something that we did in my family is we just added vegetables into the rice itself. So when you're taking a ladle full of rice, you're actually having the vegetables combined with the rice. So overall, the portion doesn't change, but the composition of the food changes. And you can do that with your roti as well, your chapatis. You can add vegetables and seeds into your dough, and it'll be more complex and release that glucose slower. Lastly, the final thing that I always say, the 80-20 rule. Any of you heard of the book Atomic Habits? Yeah? I love that book. I recommend that to everyone. It's no point doing any habit or lifestyle change all at once, everything at once, but only managing to do it 20% of the time. So I say, try to do 20%, just 20%, but try and do that 80% of the time. Consistency is key. Thank you. And now on to the next speaker, Dr. Sonia.
Hi everyone, thank you so much for having me here, Vanita. So I'm here to talk to you guys about acne scarring. Just going to find this. So acne is a really, really complex condition, as we've all gathered from the talk today. Treating the acne can be difficult, but once the acne scarring happens, it's a lot more difficult to treat. So it's really, really important to get in there and treat the acne early on so we're not dealing with scarring. That being said, scarring is still very common. A lot of people do scar. It's not down to just one reason why people scar. You can scar down to several reasons. A lot of the times it can be down to your DNA. Sometimes it can be down to skin color. So later on, I'll explain what kind of scarring our skin color tends to get. But also lifestyle factors like smoking. And if you're a picker and you pick, you're going to scar. So few things to think about if you're a picker. Next one. So how do I treat scars, or how should you be approaching to treat your scars if you have scars? So you need to think, what kind of scar do I have? The first slide that I showed you guys was a bit heavy on the pictures. I like to break it down into two kinds. So think of it as depressed scars, loads of those were depressed, or raised scars, which are hypertrophic scars. So once you know which type of scar you're dealing with, that will help decide the treatment modality. Then you've got to consider the skin type. So is there somebody who's going to pigment? What am I going to do? How am I going to mitigate that? Then the time constraints come in. We have to be realistic. It's not going to happen overnight. Collagen isn't going to remodel overnight. You have to give yourself time. But how much time can you give? How much time can you take out of work? How much time can you have downtime if you're having invasive procedures? So that's another thing to think about. And affordability. Let's be honest, scarring treatments aren't cheap and they're not available on the NHS. So you're going to be shelling out a lot of money. So you need to be mindful what works for you. Don't fall into miracle cures because scarring is very, very difficult to treat. So this is just an overview of how I would treat depressed scars or raised scars. When looking at depressed scars and raised scars, there's two things to consider. We need to either reduce the depth of the depressed scar or reduce the height of the raised scar, basically. And the second thing, which is common in both of them, is reduce the pigmentation, reduce the skin darkening or the post-inflammatory erythema that we've got. So once you've got a depressed scar, you can go in with a few options. Simple things like microneedling, which isn't as expensive. Tend to often combine it with microneedling and PRP. You do get good results. There's lots of research out there that's shown quite promising results, combining them two together. Subcision is an interesting one. So if you're somebody who's got deep pitted scars, they're really tethered onto your skin, you need to release the tethering. So that's when subcision comes in. But we know now this is quite a deep scar, so I probably need to go in and treat it with dermal fillers, but obviously be mindful who you're seeing, who is going to do this quite safely. Now we go in with the lasers. So lasers come with quite a bit of downtime depending how aggressive you're going to go. Erbium, not so much, but CO2 laser will come with downtime depending how ablative I've gone. So with this, we again need to be really, really considerate. You may come across lots of clinicians who'll say, oh, I don't think you can have CO2, I don't think you can have laser because you're darker skin type. That's not true. You can. You just need to mitigate, you need to prep, and you need to have a good post routine in order to have good results from this, and obviously make sure that you're not going to pigment, not going to have any complications from this procedure. And radiofrequency microneedling. So who's familiar with Andy Murray's mum having the Morpheus 8 treatment that was all over the news? Show of hands. So that's actually the treatment. So Morpheus 8 is radiofrequency microneedling. Loads of companies do it. So there's one called Secret RF, which I use in my clinic. Fabulous results because you're combining heat and microneedling. So it's going to promote new collagen. And we can go in with chemical peels, which can help with the erythema, hyperpigmentation. Obviously, little caveat here with the depth of the peel. See somebody who knows what they're doing and who knows how to prep your skin with this. With all these options, the main thing is you can't have it done and expect results in 1 month, 2 months. You're going to be looking at a long, long time, and you're probably looking at a treatment every 4 to 8 weeks over the space of 3 or 6 months, depending what you're having done. So we've got to be realistic here. Raised scars, more common in skin of color. So remember at the start, I said, if there's lots of reasons why you're going to scar. If you're scarring, one of the reasons can be skin of color. We're more likely to scar with raised scars. Who here has experienced raised scars? I can raise my hands. Got one here. I get it all the time. So it's just a lot more common in skin of color. So we need to reduce the height of the scar. So how are we going to do that? Steroid injections, absolutely brilliant. I also use lasers to introduce the steroid into the skin, so CO2 will help with that. And using a pulse dye laser with new, fresh red scars is really, really good at helping flattening them down. I try and combine a few together because you want to make the most of your time, right? You don't want to keep coming back recurrently. So I try and combine a few treatments together. And you've also got to remember, everyone will have all these types of scars in just one person. So you're not just going to be dealing with raised scars. You might have depressed scars, you might have raised scars, you might have a combination all over. So we've got to be holistic when we're trying to treat people with acne scarring. And the last, and probably the most important one, it's really important to treat your acne before you go in to treat scarring. Because let's be honest, you're just going to put money down the drain. There's no point treating your scarring if you're going to keep getting new acne and you're going to keep causing those scars. Second one, so really, really important to treat recent scars. The older they get, the harder it is to treat them. So that's why I mentioned, when scars are red, fresh, it's a lot easier to treat them then. That being said, if you're somebody who's been on Roaccutane or isotretinoin, you've got to wait your 6 months. You can't go in and treat your acne scarring because with isotretinoin, your skin is a lot more sensitive. And the most important one, and I think we all know this, and Vanita goes on about it all the time as well, it's really, really important that you use sun protection because let's be honest, we've now treated the scar, we've treated the depth of the scar, we've treated the height of the scar. The discoloration still needs to go. So you've got to use your sun protection. That's it, I think. Fab. Thank you. Going to hand it over to Dr. Aram.
Move these down. Hello. Shout out to Dr. V for having me. I'm Iram. I'm a GP based in Wiltshire, and I work with a largely South Asian population, so I see a lot of skin of colour. I also run an Instagram account called Skinful, where I review all the things that I put on my face for acne and hyperpigmentation. Now, I want to start off by asking you all a question. Please raise your hands if you've ever watched a TED Talk on YouTube. Okay, now raise your hands if you follow the TED Talk with your own imaginary TED Talk. Just me? Okay. Well, the talk that I find myself doing is this one, When to See a GP with Acne, and a bit about PCOS. Now I'm going to ask you to raise your hands again if you would recommend this patient with acne to see a doctor. Okay. What about this one? Okay. This one? Okay. This one? This one? Okay. So the reason I wanted to do this talk was because 15 years ago, as a medical student, I would have probably only raised my hands for the last 2 slides. And in fact, it took me a series of dermatology lectures and a GP placement to gain the confidence to see a doctor for my own acne. What we commonly hear is to see a doctor if you suffer from cystic acne or scarring. And whilst that is a good time to see a doctor, it's important to know that your family doctor or GP has treatment options for the full range of acne severity. So whether it's mild or severe, we have guidelines with evidence-based advice on skincare, diet, mental health, and of course, topical and oral treatments for acne. So does that mean everyone who has acne needs to see a doctor? Well, certainly not, but if you are struggling with any aspect of your acne, then the take-home message from this talk is that you can come and see us. Now, I know that's not always the easiest thing to do, so I'm going to go through a quick case study so you know what to expect if you do see your GP, and hopefully it will empower you to come and visit us in future if you wish to do so. So I'm going to tell you about Rita, a 29-year-old South Asian woman who calls her doctor for an appointment, but of course there aren't any appointments available, so she's offered a telephone consultation and is asked to send in pictures of her skin. So I have a look at her pictures and I call her back and I ask her lots of questions about her acne and medical history, including her periods, her mental health, her lifestyle, her family history, and her drug history. And she tells me this. She's had acne, like the first picture, since she was a teenager. It only affects her face, and she's tried lots of remedies, spent lots of money trying to fix it. For the last 6 months, she's been using salicylic acid-based skincare, and she's managed to improve her skin to the middle picture. But she's getting married next year, and she's becoming increasingly obsessed with every new spot and every new scar on her face, and it's getting her down, and she wants to know what we can do to help. So we first established that she's not clinically depressed or anxious, but it is affecting her self-esteem. And she's not under any other stresses, she doesn't have any family history, she's not on any medications. But she does mention that she has irregular periods and excessive facial hair. So I begin to think, this could be polycystic ovary syndrome, as someone else mentioned, PCOS. And I explained to Rita that this is a condition that affects Black and South Asian women with a greater severity than it affects Caucasians. Now, we don't know exactly what causes it, but it's characterized, as you heard, by hormonal imbalances, so primarily a raised insulin, which controls your blood sugar, and subsequently raised sex hormones, including testosterone, which you've heard twice now already, but I'll repeat. It increases your sebum and oil production, so that lovely bacteria proliferates and causes spots. Along with that, you get the period and fertility problems, you get excessive facial hair, but hair thinning on your scalp, and you also get difficulty losing weight and hyperpigmentation under the neck folds and armpits. So we decided to test Rita for this condition with blood tests and an ultrasound scan. And we also tried to treat her spots in the meantime. Now, as GPs, the only thing we can't prescribe is oral Accutane. But we do have lots of options in the form of topical treatments like retinoids, azelaic acid, benzoyl peroxide, and topical antibiotics. I don't know if I've mentioned that one. And also oral treatments in the form of antibiotics and contraceptives. Now, Rita doesn't want to take tablets. She wants to try a cream, and we do a combination of retinoid and benzoyl peroxide for 3 months, after which point she comes to see me, and her skin now looks like this, so much better than the first picture. And her PCOS tests come back negative. She does have a low iron, so we start her on treatment for that, and that's possibly what's causing her irregular periods. She decides to continue her combination of retinoid and benzoyl peroxide for the next 3 months, at which point I'll review her again, and hopefully she'll be living happily ever after with well-controlled acne. So I hope that demystifies the process of seeing your doctor and gives you an idea of what to expect. And if you do get anything less than a thorough consultation and follow-up, don't hesitate to seek a second opinion. So to summarize, first, if you are struggling with any aspect of your acne, remember you can come and see us. We're much easier to get hold of than dermatologists. And second, please remember that women of colour suffer with PCOS with a much greater severity. So if you do have acne along with any of those other symptoms, please think about getting tested. Thank you for listening to my TED Talk, and I'll hand you over to Dr. Penny.
Hello, good evening. Thank you, Dr. P, for inviting me. I'm Dr. Amanda Penny. I'm a full-time medical aesthetic doctor. Can I just get a quick show of hands in the room, please, as to who here is a healthcare professional? Okay, so actually quite okay, just so I can kind of tailor it a bit more to you. So there's a little bit of crossover in our talks. So I'm talking to you a bit about lifestyle changes, and these are sometimes the kind of overlooked parts, the parts that are really boring, that people don't really want to do, but actually you really need to empower yourself, if it's you with the acne, or your patients with that ability to take control for themselves. And a lot of that isn't just about the skincare. It is all the things around it that are inside and outside of our bodies. So a little bit different. And I'll skip over some of the things that we've covered before. So particularly in aesthetics, I often get patients who want a treatment and I want to see a result straight away. And it's just not going to happen with acne. You know, there's a lot of managing expectations and really saying, you know, patience, commitment, and consistency are key. And I tell every patient that comes in, whether it's for acne or often I'll see someone, they might see me for acne as a primary concern, but often it's actually an incidental or a secondary concern, and then we'll end up treating it. But I'll say to them, look, don't trust me. Don't take my word for it. You take your photos every 6 weeks. Every time you make a change, you take those photos. Do not trust me. And it's those patients, because otherwise they look in the mirror every day and they don't see the change, but they take their own photos and they see the change 6 weeks later. They're, oh yeah, oh actually, yeah, what you said is right. And there's some accountability in that because they know they're going to take that photo in 6 weeks. So I don't need to tell you anymore. We are all sunscreen czars. Please use your SPF. Like it's, you know, if you're going to do anything else, if you're going to go up that ladder of aesthetic care, there is no point doing anything else unless you're going to do some of this. So SPF, and then your next biggest one, if you're smoking, please stop. So stress. I wish I could take away all your stresses. I really do. It would solve so many lifestyle medicine issues. But, you know, I'm not going to go into the physiology of it. We've gone into the physiology of cortisol excess and inflammation and your androgenic effects. But if we can develop some methods to reduce our stress, or at least to manage our stress on a day-to-day basis, then that goes some way towards helping. So we know now, we have definite proof now that stress affects our gut microbiome, which in itself can exacerbate acne. And we also know, each one of us knows that when we're stressed, we don't necessarily eat so well, and maybe we're having much more in the way of processed foods, maybe we're rushing our foods, maybe like some of us, we haven't had lunch today and then we'll grab something and have a bit of an insulin spike at this time. And then, you know, there are easier ways to get that relaxation in. And maybe it's just your 5 minutes, that 80-20 rule. Maybe we're just doing 2 minutes. But that's better than trying to commit an hour of meditation. You're never going to do it. But maybe it's 2 minutes. Maybe you can do it on the tube. And there are apps for it. And, you know, you don't have to do all of these things, but there are ways and means. And they all add up. And I think we don't appreciate them enough. And we quite often fall into this trap of wanting to have a quick fix and see something quickly, but you know, a lot of these things together will help synergistically. Sleep. Again, I wish I could give you more sleep. Sleep is so important, and it's also really important for our skin's DNA repair cycle and also for absorption of nutrients from the skin. It does affect hydration levels, which again is really important, particularly for putting drying ingredients on the skin for acne. Again, lots of apps to help with sleep hygiene practices. Just one to think about in and around acne care. And exercise, both for reducing stress and also regulating your sleep patterns. But one thing of note, maybe worth washing your face after high-intensity exercise, just to remove some of that sebum and sweat from the skin. Environment. We know that our skin is being attacked day to day with free radicals. We get a lot of free radical damage, which damages the DNA within the skin, damages the collagen in our skin, and increases premature aging. We know that it increases inflammation, which is part of the process of acne, but also can make things like eczema worse. Really useful to use your antioxidants in that case on the skin and in your diet to help with that. Some things inside here, I put a few little hints and tips within there, here and there. People often forget about their pillows, particularly teens. If anyone's in this room has got preteens or teens who are starting to develop their spots, really help them. Don't tell them what to do. They'll ignore you if you're the parent. But empower them. Give them something that they can do. Make it their skincare routine. My just turned 13-year-old, I put the list up of what he does day and night, and I just Treat it like brushing teeth. How painful was it teaching them to brush their teeth? Same thing for their skincare. It's going to be every day, morning and evening. Empower them to do that. That also includes the things like the pillows, the towels, cleaning their phone maybe once a day, particularly, I'm afraid, women with long hair. Pulling your hair back maybe. Making sure that you're taking your makeup off. If you're a teen girl and you're not taking your makeup off properly in the evening and maybe not wearing any at the weekends, that's a good habit to get into. And another thing, we always talk about cleansing. How many people cleanse and then they wipe and they still have makeup on that? I'm sorry, that's not clean. You go back and you do it again. How are you going to get your products in at the level, at the depth and the dermis you need it when you've got makeup blocking its way? You have to clean it off. And then just touched on a little bit about hormones through life, as we mentioned, the 3 Ps that can affect your acne as you go. So acne and makeup, should you or shouldn't you wear makeup? So we've got this vicious cycle. I've got spots, got to cover them up with thick foundation, and then we're aggravating the acne. So, and that can be incredibly demoralizing. A number of patients I see, we have a policy at one of my clinics where you don't come in with makeup. Now, people can't do that. It can affect them so much, they cannot go outside without makeup. But we see patients months later who've been on that journey and they're saying, I love it. I don't have to wear foundation. How demoralizing is it to not be able to go outside without some makeup on? And they can't even come to a clinic where we're telling them, we're not going to see you unless you've got your makeup off, and they still can't do it. So we'd recommend that instead of covering everything over, maybe just try some color correcting on the areas that you need it for the hyperpigmentation or the erythema, and use some mattifying powder if you can, a lightweight powder, something that's non-comedogenic. And if you can, as I say, like with your teens, if you can reduce the frequency and the duration of makeup, there's nothing wrong with taking it straight off as soon as you get home. In fact, it'd be pretty good to do that. But I do get it's not possible all the time. I haven't rocked up here without makeup. So things for you to look for. We've kind of talked about a lot of these. Oil-free, hypoallergenic is good in terms of not contributing to inflammation. Mineral-based makeup is good, and they'll often contain zinc, clay. Some of them will actually even contain salicylic acid in a makeup product. Avoid drying ingredients, sensitizing ingredients, acrylics, silicons, anything that's going to block those pores. And my bugbear, Clinique's toner. Clinique toner, you can smell the alcohol from the next room. Do not use that, please. So alcohol, really super, super drying. If it's high up on that list of ingredients, just chuck it. Don't even give it to your granny, just chuck it. And there's some evidence for talc. For some people, it can not work. But the silicone thing is one of the underrated things. Some people get it from their hair products as well, and they'll have a particular type of acne that looks very similar. It's often on their brow, and teens will get this. It can be worth doing things like after they've done their hair, particularly if they're doing edges. Edges are really, really popular at the moment, to wash their face after they've done the styling, which I don't think about. Cleanse properly, no wipes, please. They're rubbish for the environment. They're rubbish for your skin. You're leaving chemicals on your skin. Wipes for me, I don't know if you guys have a rule of it. Wipes only ever come out if you are glamping or you're going to the gym, maybe. And even then, you wash it off with water. Otherwise, no wipes. And then remove your oil-based makeup. And then you remove your water-based makeup. Your cleansing stage should be at least a minute. At least. So, you've got time as 2 minutes for brushing your teeth. Do the same for washing your face. At least a minute for each of those steps. And if you're still seeing makeup coming off after that, you'll do it again. But not too aggressively, like maybe not with a foaming wash all the time with those. It just allows you the ingredients to work where they need to work, at the depth that they need to work. And helps to, just regulate that sebum production. Please avoid over-exfoliating. You don't want to break down that barrier as well, and as we said, have a whole other set of problems happening. Moisturise, just because your skin might be suffering with acne doesn't mean you don't need the moisture from within and without. And as I mentioned, pillows, towels, making sure that your phone, maybe just give it a once over with a little alcohol wipe once a day. And that kind of is a little bit of a whistle-stop tour of things around medical treatments that we can do. But really is a case of empower yourself, empower your family member, whoever has it, empower your patient. Give it time, patience and consistency, and never trust the person telling you. Take your own photos. Okay? I'm going to pass you on to Dr. Gabby. Thank you very much.
All right. Good evening, everyone. I'm Dr. Gabrielle McCauley, and thank you for having me, Dr. V. I'm going to be speaking about the top causes of acne and also common mistakes that people make with their acne. I want people to remember that even though we're talking about acne and skin, our skin does not dictate our purpose and it doesn't define our identity. It's useful to get good tips like what we're talking about tonight, but beauty is being comfortable and confident in your own skin, like Iman said. So my background, I'm a private and also NHS GP. I'm a family medicine specialist, and I've done extra training in skincare, nutrition, and also women's health. I've done extra training in functional hormone replacement, and I'm really passionate about preventative medicine because prevention is always better than cure. So today we've already spoken about a lot of the top causes of acne, but I'm going to be reminding you of some key things. So the hormone imbalances we've spoken about today, like puberty, pregnancy, and also PCOS, often contribute to acne. And it's important to know that when we get a lot of insulin in the body from eating too much sugar or having insulin resistance, this actually drives women's ovaries to produce testosterone. And a lot of people don't know that we actually produce that testosterone from the ovaries, and that drives the oil production. Many of my patients are using a lot of oil-based cosmetic products, and we've spoken about how when sebum builds up in the pores, this can lead to acne, so it's a good idea to avoid oil-based products. We've already spoken about stress and how when we have cortisol dysfunction, which is produced from our adrenal glands when we're stressed, again, this can cause the body to produce more oil. And when the brain is dealing with stress, there's another hormone called cortisol, corticotrophin-releasing hormone, and that actually works directly on the pores to produce more oil in them. There are some nutritional deficiencies that can contribute to acne. So, for example, if we're not getting enough vitamin A in our diet, we can suffer from acne. Now, vitamin A is found in foods that are orange, so things like carrots or melon. These are going to have high levels of vitamin A that help to reduce sebum production. And just remember, vitamin A is the vitamin that's found in retinol. So when we're putting retinol in our skin, it comes from vitamin A. Also, if we're not eating enough vitamin C, we will not have enough antioxidant properties in our body. And antioxidants work against oxidative stress, which is when all the toxins that's in the environment damages our skin cells and causes dysfunction. And another one for people to be aware of is omega-3. This is really important for skin health. Omega-3 has anti-inflammatory properties, and it's found in things like our oily fishes. It's also found in algae for people who are vegetarian. Now, the Western diet, as we've already mentioned, is often a pro-inflammatory diet. So it's eating a lot of sugary foods, a lot of white carbohydrates, and these are just really toxic for our bodies, and I'll explain why. In the gut, when you eat a lot of sugar, this messes up our gut microbiome, and it means that the good bacteria that we have in our gut are not happy, and then the bad bacteria have a party. And this can lead to leaky gut, and it can make the gut produce a lot of chemicals that cause inflammation. And we need to remember that acne is an inflammatory condition, so it's where we have too much inflammation. And another cause is not using a personalized skincare regime. Everyone's skin is different, so everyone will need a slightly different regime, and in different times of the year, your skin may act differently. And even within your sort of cycle, your skin may act differently. So you've got to adjust your regime depending on, it could even be which country you're in or where in the country you are, because the air is different, okay? So this is the main part of the presentation. So ways that people try to tackle acne, so they have good intention, but they often go wrong. And small modifications can have a really big impact on the success of the treatment. So we've already spoken about how we need to manage bacteria when we're looking at acne, and people try to do this by using a lot of soap and using really strong antibacterial soap. So I remember my mum giving me a really strong yellow soap. But actually, this is the completely wrong thing to do, because soap is alkali and our skin in its natural state is acidic. And we want to keep the skin acidic so that the microbiome, so this is the different bacteria on the skin, can be balanced. The acidic skin helps the good bacteria to be happy and it keeps the bad bacteria at bay. But if you just wipe everything off, then you're going to get proliferation of that bad bacteria. So soap is alkali and also toothpaste is alkali. So putting toothpaste on spots is just the wrong thing to do. I've done all of these mistakes, so that's why they're up here. Then people hear about how acid is really good for the skin, but there's lots of different types of acids. And the acid works to break down the bonds between the skin cells so that they can fall off and your pores are not clogged. But if you're using stronger acids, things like glycolic acid, they penetrate very deeply into the skin and they can be too harsh for people, especially darker skins, and that can promote inflammation and pigmentation. So more gentle acids like lactic acid or salicylic acid is really good because it will clean the pores from inside out, but it will be more gentle on the skin. And then with acne, people think, okay, it's an oily skin condition. I'm not going to moisturize. I'm just going to use a serum or something with no moisturizer. But you actually still need to hydrate the skin because on the top layer, you have the hydrolipid barrier. This is a combination of water and oil, and it does, in the right amount, it keeps the skin healthy. So you still need to hydrate and moisturize the skin, even though you've got acne, using a water-based moisturizer. We spoke about the microbiome already, and then some people, they're just not exfoliating at all, and it's really important to do that so that your skin isn't building up, and it's better to use a chemical exfoliant than a physical one, which can cause those micro tears that my colleague spoke about. Next up is not using a serum. So a lot of people, they're using their cleanser, they might be using SPF, but they're not using a serum. And serums that contain things like vitamin C are really helpful because vitamin C is antioxidant, as I mentioned, but it also helps to stimulate collagen production, which will help stop the skin from sagging. And I'm really happy to see that Dr. V's cream, the moisturizing cream, it's a serum and a moisturizer in one because it's got the vitamin C, so that's amazing. Moving on to stimulating cell turnover. So with the skin cycle, you have the new skin cells at the bottom, the baby ones, and then the older ones at the top. And you want to have your skin cycle as fast as possible. So with babies, it's only a few days, and older people, it could be 3 months. So you want to push the skin cells up by using retinol, and you want to take the top layer off by exfoliating. So you've got to do both. You can't do either or. So some people, if they're not using retinol, they're not going to see great results. Some people, they're using too much retinol. So one person might need to use their retinol every single night, but somebody else might only be able to tolerate it 3 times a week or once a week. Everyone's skin is different, and people can see inflammation if they're not using it right. So if you've got sensitive skin, it's better to start off gently and then work your way up. And then finally, not waiting long enough to see results. So when you're doing a new skincare regime, you're going to see changes in the skin in the beginning, but you've got to leave it at least 4 weeks to know how you're responding, because it takes at least that long for a full skin cycle to happen. And then finally, sunscreen is so important. We don't want to think about pigmentation after the fact. We want to prevent pigmentation. And I recommend that people look for barrier sunscreens that contain chemicals like zinc oxide, because these just sit on the skin. They're not absorbed and they're not toxic like chemicals such as oxybenzone. And they protect against both types of UV light. So it protects against pigmentation but also aging. So look for a barrier sunscreen. I am giving away a free nutrition for skin health guide, so please do pop to my Instagram, send me a message with your email address, and I'd be happy to send it to you, because we have spoken a lot about topical skincare, we've spoken about diet, but there are some other extra tips that you can find in my skin health guide, so please do follow me and check out my blog. All right, so thank you everyone. My hand over.
Guys, this is working wonderful. Thank you so much. I think we've all learned so much. Please, can we put a round of applause for our doctors on stage? And now for the rapid fire round. And you can ask us anything. No, you can't ask us anything. You can ask us about acne. And if there's someone in particular that you want to direct your question to, please do. I know everybody's starving, and so we've got food ready to go. But we're going to do 5 questions. So hands up if you've got a question. And we've got someone with the mic. Anisha, got someone with a mic? Yeah, amazing. Got one lady here.
So my question is, so I found that, I know one of you have said, oh, you have to use SPF. But I personally found whenever I use SPF products, I will have a breakout. Like anytime I put SPF on, I will have the worst breakout ever. And it always happens in summer. So it's like, what would you recommend what type of products would you recommend if you always break out when you put SPF on your face?
Yeah. Who would you like to direct that to? Do you want to do that?
I don't mind whoever.
So I get this a lot. So I'm a GP with a special interest in dermatology, and I do a lot of aesthetics, so I get this a lot. A lot of people say that they break out with SPF, and it's not untrue. It is going to happen. But I think we live in a time, there are not hundreds, not thousands, tens of thousands of SPF brands out there. There will be one that will work. It is trial and error. Try and stick with lighter formulations that are oil-free, formulations that are non-comedogenic, because that means it's non-pore clogging. Try and stick with ones when their kind of added ingredients are also things that are not comedogenic. So things like ceramides, things like hyaluronic acid, things like glycerin. Those are quite light on the skin. So look at formulations. Try loads out. I know obviously a lot of sunscreens can be quite expensive as well. So try and see if you can get testers. Whenever I see people in my clinic, I stock a lot of testers. I give loads of testers out to people because I don't expect people to spend a lot of money on sunscreen especially. So try. You will find something. I know it's a really, really common thing. It does happen, but you will find something.
Okay, next question. Hands up. Yeah.
The question that I have is, you mentioned about chemical peels. What are your thoughts on like the famous green peel? Because it's quite an abrasive method.
Yeah. So I've seen a lot of hyperpigmentation happen from the green peel in skin of color. I'm not a fan of the green peel. You are causing those micro tears that we've been talking about today. So I'm always going to prefer you go for a chemical peel and a slow chemical peel. So this is why I always opt for mandelic acid. It's a massive AHA molecule, slowly penetrates the skin, and you cannot burn with it. And for me, because skin of color is my whole world, I look for 0 adverse reactions. 0. So for me, there is no percentage that's acceptable for burns. And that's why I always opt for mandelic or lactic acid. You know, I'm not the biggest fan of glycolic acid. And I do get a bit of backlash for that. What I'd say is if you're going to use glycolic acid, I like it at 5%, or make sure somebody knows what they're doing, because you want to neutralize it if you're using a higher percentage, and otherwise it can lead to hot spots and hyperpigmentation, which I've also seen. And like I said, for me, 0% reaction is what I'm looking for with skin of color. Yeah. Next question.
So,
we got 2. Oh.
Some of the advice you gave was quite gender agnostic. Are there specific things that men should sort of look out for or are more susceptible to, or is it quite a gender agnostic approach?
Specifically for acne or for just general skincare? Yeah. Does anyone want to take this one? Okay.
So I think some of the things, obviously, with the PCOS were quite kind of female driven. But in men, testosterone is, again, a driving factor. A lot of men do tend to have, oily T-zones and things. So the ingredients will still be the same. The treatment options will still be the same. The gut health advice will still be the same. The scarring advice will still be the same. It's just the pathogenesis sometimes can be a little bit different, but we are treating it similarly, bar obviously the hormonal imbalance that comes in with PCOS.
In my talk, I forgot to talk about dairy, which is a really big factor. I think it's so important that we know and we discuss the fact that studies have shown that dairy is linked to acne. Dairy contains a lot of hormones for baby cows to grow into big cows, not for humans. It does contain testosterone. It does contain the insulin-like growth factor that we spoke about. So cutting out dairy is a really big step that everyone can make if they're worried about acne.
Yeah. So yes, we have evidence for the dairy, but we also have a lot of evidence for the sugar. And actually, on a practical note, what I have found is a lot of patients will swap out dairy for oat milk. But if you look at oat milk, super high sugar. So they're swapping something that has a bit of evidence for something that has a lot of evidence to say don't have high sugar, processed sugar, and they're not really aware of it. So yes, cut out dairy, but make sure that you're not replacing it with something that's not helping you. And on a little practical note about men, this is, again, just more practical stuff. Everything we've said applies, but maybe it's just my husband. My husband doesn't want 7 bottles. So there are products out there that are multi-purpose. In fact, the Trio Blemish is multi-ingredient, multi-purpose. And actually for men, teenage boys, husbands, those are the things that, because it's your wives buying the products for you quite often, or your mums. He said, no, it's not. It's me. You can, on a practical level, it can be less intimidating to see 1 or 2 bottles than 7. Yeah.
Can I just add, I find that a lot of men get acne on their backs and shoulders rather than just their face. So whatever you use on your face, if you're using a salicylic acid cleanser, you can just use it in the shower if it's affecting you elsewhere.
Also down to guys actually having rucksacks. So mindful with that, with the back acne. Before I hand it back, I know Erin mentioned that Roaccutane or isotretinoin is limited to hospitals. So GPs can prescribe it if they have a special interest in dermatology. So you can access it through community dermatology clinics, and the waiting time is a little bit less. But obviously it depends on the area that you're in.
Good. Next question.
Yes, okay. My question is about treating acne in someone who has a sensitive skin. So I use myself as an example. I've realized that when I use even salicylic acid cleansers, with not even up to 2%, my skin barrier is down. I'm breaking out a lot. And it's like I have oily, acne-prone skin, and then I have sensitive skin, and I don't really know how to navigate dealing with that.
Are you reacting to the salicylic acid, or...?
I'm not even sure what the problem is, because when I now use like micellar water on my face, it's stinging, and it's like I could use micellar water before.
So now you've damaged the skin barrier at this point.
Yeah. From salicylic acid, that's not
Correct,
up to 2%.
Yeah. First of all, you have to repair the skin barrier. Second of all, you might be reacting to salicylic acid. It doesn't suit everybody. You might actually want to try, remember I wrote on the slide, the benzoyl peroxide, start at 5% as a wash. And that's antibacterial. It's very effective. But first, you need to repair your skin barrier. And this is we all hear this time and time again. Remember, I said that these ingredients are really drying to the skin. Retinol, salicylic acid. You're bombarding your skin with a lot. And then we get to a situation where your skin is dry, and dry skin equals sensitive skin. And then anything you put on top is going to burn the skin. And so we have to protect the barrier first. And do one product at a time. Sometimes we want to chuck everything in at the same time. We get really excited. Even with my kit, I'm going to give everyone a kit. I'm not saying start with everything simultaneously. Put 100 ingredients in this. Start with one thing at a time and slowly, put it into your routine. So that will help. But first, repair the barrier, and then start with benzoyl peroxide first, I'd say. Yeah.
I find a lot of people who can't tolerate retinoids and salicylic acid. Azelaic acid works really well at a low percentage. I find for some reason it tends to irritate people less, and it's really well tolerated.
Yeah, so your GP can actually prescribe 20% for acne, which works really well.
Yep.
There's two different types of acne. There's acne rosacea and acne vulgaris. And today we've just spoken about acne vulgaris. But a lot of people who have very sensitive skin and are treating acne, it's not the acne vulgaris, they have rosacea, which is a dry skin condition, and it can look similar, but it's more common on the cheeks. So it's a good idea to see a doctor and make sure that you have the right diagnosis.
Absolutely. Next question. And we'll make these, we've got two more, and we're just going to make these two the last. So you.
Hello. Okay. My question was around diet. I know you just mentioned people swap out dairy milk for oat milk, and that is me. So I'm lactose intolerant, and I know I'm probably not tolerating the oat milk that well either, but then I'm also intolerant to soy and coconut. So, and almond milk is quite watery, so I just, taste-wise, I don't go that route. So I just kind of always feel like my hands are tied. So is there any kind of like recommendation, or should I just like give up on coffee and cereal altogether?
Dr. Amanda, this is you. This one's all you.
I mean, if you're having it for cereal, there is an argument for cutting out cereal anyway in our diets. Coffee is a harder one. Maybe you take your coffee black. My normal recommendation is that you go more for the nut milks. They're higher protein, higher fat content, lower sugar content in general, not all of them. Cashew is still quite high in sugar. But yeah, almond is a big favorite for that, for being a lower sugar content. It's a tricky one. It's a bit like me saying, please reduce your stress and increase your sleep. Easier said than done. But it is about being aware of these things and making those small changes. And it doesn't have to be perfect. It really doesn't. You can, there's a lot about being kind to ourselves and just being like, okay, I can do some of this. And it's okay.
Have you tried doing a food diary of seeing which milks or whatever actually flares your acne up?
Yes. So that's kind of where I got the knowledge of all the things that I'm intolerant to. I also don't eat meat or dairy and things like that. So I don't know, I do feel quite limited. And then I end up eating loads of carbs, white carbs, because there's so much I can't eat. So then, yeah, the diet's just not that good. But then there's so many things I'm intolerant to as well.
It might be worth looking at all the different sugar components and stuff, or the ingredients even at the back of your milk cartons to see which ones are lowest in sugar. But again, if it's taste versus your, intolerances, it is a difficult one, I have to say.
Also, if you're having high carb in your diet, that's probably the bigger problem.
High glycemic index.
I was going to say, there are so many different types of milks. There's even hemp milk, but you're not expected to figure it out all on your own. If you have lots of intolerances to different foods, it is a good idea to seek that expert advice and keep a food diary and have an appointment with a nutritionist, because they have such a breadth of knowledge that we really don't apply as often as we should. They know so much more than all of us doctors on stage about nutrition, and they can really help you titrate your diet plan to suit you personally. So go for it, I would say.
So with that, I'd like to conclude our teaching for tonight. And now I want you to eat, because everyone's starving, including me. You? Thank you, everybody.